Hey guys, it's Dr. Anderson at 𝗨𝐻𝑆 Chiropractic in Missouri City. Today we're continuing our conversation with arthritis. So I made another video on this page actually showing digital x-rays on some of our patients where you can actually see an example of what that looks like and what can be done over time to start to change it. And today I just want to give you a little bit more just understanding about things that you can do with arthritis. One big thing with arthritis that people have misconceptions about is they think it hurts too bad to exercise and they don't want to put any stress, whether this is your knee, your hip, your spine, your back. And I get sometimes you might be limited if you're in severe pain, but you got to realize that when you have degenerative arthritis that's there due to an old injury that stayed there, or just little by little repetitive wear and tear on your joints over time, that's abnormal extra stress, then what's happening already is the joints are starting to lose their normal biomechanical alignment, where the joints might become shifted, and they might become shifted out of alignment and it gets stuck in a bad position, or you have to have an abnormal alignment of the spinal column, and it's creating stress and wear and tear little by little over time on the joints. And what that does is your brain literally starts to sense this abnormal weight demand, and very intelligently it starts sending extra resources and calcium and things like that to the area to actually build and reinforce and add extra bone growth under that weight demand. And the reason why is because it creates a lot of stress on the joints, and your brain's doing everything it possibly can to reinforce that area and make it stronger under that extra weight demand. The problem is, if you're just treating the symptoms of arthritis with painkillers or shots or stretching, if you're never actually getting the actual structure back moving towards that normal alignment and restoring the normal mechanics and motion to the joint, then the cause of the problem, even if the drugs work great, even if the shots work great, even if the stretches help you feel better, that can be great for pain, but it's leaving the cause unaddressed. So it's just like a cavity in your tooth. If it stays there, what's gonna happen the longer the cavity stays unaddressed? It's gonna get worse. Even if you take a shot in your tooth, even if you rub the creams on your tooth, even if you take Tylenol for the toothache, it's still gonna remain, and it's gonna continue to grow over time and cause destruction to the tooth. That's what our arthritis does to the joint. So what's really great is with corrective chiropractic, what we do is we can literally take digital imaging when necessary. We can measure and identify exactly where the biggest stress points are that are causing the damage and the mechanical wear and tear to cause that extra bone growth, that over time starts to lock up the joints, makes it stiff and achy, especially in the mornings, or if you have been on a long car ride or sitting in a chair too long, you go to get up and you're kind of stuck and you can't stand up. That's a lot of times because there's degeneration starting to occur, which is just a response to this cause that was left there. So over time we can identify that, we can take pictures of that, we can measure exactly where the cause of that is, and we can start to move and train and create a customized plan of approach with corrective adjustments and corrective exercises to teach the tissues how to start to get better mechanics, better mobility, and better alignment. And what that does is it helps you feel better in the moment. But what's great is it's actually working the real root cause of the problem, and over time you actually can stop that arthritis from progressing and building and getting more debilitating over time, limiting your ability to do what you love with golf or riding your bike or playing with your grandkids or whatever you want to do. The longer we just treat pain with medication or stretches, it's going to continue to get worse to the point where at some point it's not going to be able to be improved anymore, right? So you can't reverse the degenerative changes that have already occurred, but you can live a great life as long as it doesn't keep getting worse every month that goes by and every year that goes by, and you can start working the alignment and the mechanics back into a better, healthier state, right? And another thing I'll say is that people do underestimate the time it takes for these things to progress. So there's been numerous studies, orthopedic surgical studies, even some chiropractic studies, where they actually wanted to know when that joint is misaligned and it's stuck and it's not going through its normal motion, how long does it have to stay there before it actually changes the bone permanently, irreversibly? And what they found is it's 2 weeks. So when any joint in your body, your hip, your knee, your shoulder, your spinal column, is not going through its normal mechanics, it's not moving and it's not aligned for longer than 2 weeks at a time, that segment microscopically, when they look at the cellular changes that occur, they found that there's irreversible eburnation and changes and progression of degeneration of the joint and the tissue, that it's irreversible. There's nothing that can be done to reverse that microscopic change, and that microscopic change compounded every 2 weeks for a month, in 6 months and a year and 10 years later, every moment, every year that's passing by, it's getting harder and harder to work with. So guys, the best time to ever work with your spine was to keep it healthy and maintain it with lifestyle chiropractic. But the second best time is if you're already having these things, we gotta get started right away. And there's still so many things we can do. Even if you can't be perfect, you could be so much better than you are now. Hopefully reduce your dependency on painkillers and Tylenol and shots or ibuprofen, or always feeling like you're constantly have to stretch it every time you stand up to get moving again. We can get you a function better and better to a better life with less limits.